Welcome, everyone, and thank you for joining today. Before we begin, I would like to invite us into a brief moment of arrival, especially as we are coming from different places, roles, and experience, and together in one place at this webinar space virtually. If it feels okay for you, let's take about 30 seconds together. Sit comfortably. Just notice your breath, not changing it, not controlling it, simply observing it. Appreciating the flow of air through your nostrils deep into your lung and your soul. Then gently notice your body, your energy, your sense of ease or tension in this moment. Keep that inhale of the positive energy around you into your body and mind, preparing for the session today to observe the knowledge and wisdom. This isn't an exercise to fix anything, but just to listen to your own body and your mind, and tell your mind you're in a space of wisdom. Thank you for doing this. This exercise, I would like to do it at first before the start of our session because very often health begins with awareness before action. So, with that awareness, I would like to put on a question to you. Which area has been most challenging for you or for the people you support recently? Is it breathing, energy, digestion, blood sugar, stress, or sleep? For many people, you can have three or more choices or two or more choices. As you can understand from this question, today you'll become aware that how many things interplay into a whole body system. You're very welcome to drop your responses in the chat box or to quietly reflect to yourself, as this session today is all about awareness and no judgment. It's about 30 seconds, is finishing up closely. While you're doing this exercise, keep breathing. Now, let me introduce formally. I'm Dr. Devi Sundar, integrative mind body consultant, and I'm also founder of Teletherapies, where this webinar is happening and sponsored by Teletherapies. And I'm author of Breath Beyond Illness. So, where my work sits is at the intersection of respiratory health, mental health, neuroscience, Ayurveda, and integrative care. Over more than 2 decades of clinical and academic practice, I work with people living with chronic respiratory disease mostly. Interestingly, I found that metabolic conditions interplay with a chronic respiratory disease and digestive disorders as well. And it's both professionally and personally, I've encountered people having these multiple symptoms. And the emotional burden that comes along with it is massive. And I witnessed listening to people. Both in my research and lived experience, these conditions all interplay together. And people don't come just with breathlessness or blood sugar or just gut problems. They come and say to me, I have fatigue, I have inflammation here, anxiety, disrupted sleep, fluctuating energy, and a sense that the body is no longer working congruently for them. This is what the patient's perspective and patient's lived experience I witness. But yet, our healthcare system still tend to treat these conditions separately. So this webinar is for people joining from different places and different settings and lived experience. As a patient, carer, clinician, or a practitioner, all of your perspective matters today. So what you'll learn in this webinar today is you'll understand the shared pathways between the lung health, metabolic regulation, and the gut function, and why they matter for treatment approaches. And you'll recognize early warning signs, like, as I mentioned, few signs and symptoms earlier. So you'll learn to identify the patterns of symptom in the body and how the system-wide regulation in a body before progressing into a more serious condition. And you'll be able to apply integrative strategies. So you'll be able to discover practical, evidence-informed approaches that support nervous system regulation, reduce inflammation, and build resilience, and also support whole person well-being, move beyond the fragmented disease management towards a framework that honors the interconnected nature of human physiology. So today in this space, it is a shared learning, and it is all about your reflection and becoming aware of your own lives if you're a patient or a carer, and or a clinical work if you're a practitioner there. So this isn't about just an information session, but I wanted you to make sense of lived experiences. Questions are more welcome. And, you can drop the questions in the chat box, and it will be responded at the end. If you have questions later on after the session, you're more welcome to contact on the details, which will be displayed at the end of the session. You also are going to organize a learning thread session on demand on this webinar if there is more than 10 requests to address some common questions. Please do leave your questions, and so reflection makes you aware of what other questions you'll be having. So I would totally recommend that today. With that spirit of learning, I'm going to start the session. Why this matters today, why this topic I'm bringing up to you today. In a public health context, we all know globally there is a rise of chronic respiratory disease, diabetes, digestive disorders, and is one of the leading causes of disability. These conditions are not in silos, although the data or statistics are displayed globally as silos, but they all have interconnected symptoms. People with chronic respiratory disease have the gut issues and diabetes. And people with diabetes, chronic respiratory disease, I witnessed these kind of trend in my personal life and also in clinical work. So multimorbidity is now the norm, not the exception. And siloed care leads to fragmented treatment and poor outcomes. And there is a rising cost of healthcare without having equity or equality. So there is a greater inequality in the care provision. And this is very well known and is discussed in many papers and in our national government documents as well. We are still working towards it. I'm not criticizing here anything, but we have to make a full efforts in becoming aware. The wider the awareness, the more innovations and interventions can be brought to these conditions. And so we can intervene earlier and upstream and treat it more holistically. We are actually always tending to looking at the symptoms and labeling each condition, and we're not labeling or looking at the whole system. What I would like to point out in three of these blocks here is always when a patient comes to you, or if you're a patient yourself, you can witness yourself. There is multiple symptoms if you are being diagnosed with chronic respiratory disease, or if you're diagnosed with diabetes, or if you're being diagnosed with IBS. You have these symptoms, as you can recognize yourself: fatigue, inflammation, mood changes, and systemic distress that crosses your boundaries. They all have a shared pathway. And that's what we are going to discuss in the following slide. So I'll be pointing out certain research evidence and what is really going wrong. What is the stress physiology, the inflammation, why is it happening, and what is the balance system happening in your autonomic nervous system? Is it in balance or imbalance? And how that is going to contribute to your breathing patterns. So these are all the shared pathways which we'll be discussing, which is portraying our symptoms as interconnected, as is mentioned here. So what is actually we are going to look into is this webinar is all focused on making your mind and convincing to appreciate whole person care. And rather than looking at what's wrong with this organ, we have to start thinking of what's happening in the system, what's happening in my patient system, what's happening within me as a patient. So this is what the questions I would like you to ask today in the session to yourself and be in the space of learning and knowledge. Today is the knowledge transfer I would appreciate happening is start thinking about your systems, not the individual organs. So, in terms of when we talk about these three major conditions, like the respiratory and your diabetes and your gut issues, IBS, these all the system, the respiratory system is your lung, the metabolic system is your immune system, and the digestive system is your gut. These three systems talk to each other at the background secretly. And how these systems talk, the breathing pattern influences your nervous system regulation. Yeah. Each of our welcome everyone silos, but they all passing into a more serious condition. I want you to make sense of lived in my personal life and also in clinical work. So, and labeling each condition, and we're not labeling or looking at the whole system. What I would like to point out in three of these blocks here is always when a patient comes to you, or if you're a patient yourself, you can witness yourself. There is multiple symptoms if you are being diagnosed with chronic respiratory disease, or if you're diagnosed with diabetes, or if you're being diagnosed with IBS. You have these symptoms, as you can recognize yourself: fatigue, inflammation, mood changes, and systemic distress that crosses your boundaries. They all have a shared pathway. And that's what we are going to discuss in the following slide. So I'll be pointing out certain research evidence and what is really going wrong. What is the stress physiology, the inflammation, why is it happening, and what is the balance system happening in your autonomic nervous system? Is it in balance or imbalance? And how that is going to contribute to your breathing patterns. So these are all the shared pathways which we'll be discussing, which is portraying our symptoms as interconnected, as is mentioned here. So what is actually we are going to look into is this webinar is all focused on making your mind and convincing to appreciate all person care. And rather than looking at what's wrong with this organ, we have to start thinking of what's happening in the system, what's happening in my patient system, what's happening within me as a patient. So this is what the questions I would like you to ask today in the session to yourself and be in the space of learning and knowledge. Today is the knowledge transfer I would appreciate happening is start thinking about your systems, not the individual organs. So, in terms of when we talk about these three major conditions, like the respiratory and your diabetes and your gut issues, IBS, these all the system, the respiratory system is your lung, the metabolic system is your immune system, and the digestive system is your gut. These three systems talk to each other at the background secretly. And how these systems talk, the breathing pattern influences your nervous system regulation. Yeah, each of our organs are connected by our wiring and the commanding center, that is the nervous system, which regulates our senses and the output from the senses. And so I've clearly explained in my one of my recent YouTube video in my channel Breathe and Thrive, or with the handle of Breathe Thrive with Devi, conscious breathing, and there are a few other videos related to the similar topic. You're more welcome to go after the session and have a look at it and learn more about it. So breathing patterns is influenced by nervous system regulation that affects the inflammation and stress response throughout your body. And the blood sugar dysregulation then triggers the inflammatory cascade that impacts your gut barrier integrity and also your respiratory inflammation. And our gut microbiome health is influenced by the systemic inflammation and immune function, and also the metabolic signaling across all systems. So, this is how your three systems are talking to each other behind the scenes, which is then actually presenting to you what you feel. Your symptoms. There is actually a gut immune lung axis. We're all familiar, most of us, I think, is familiar because the YouTube education and the health sector has improved a lot. Many people, many of the healthcare professionals or practitioners are putting out all of those psychoneuroimmunology related contents. In my channel as well, I put a few of those, so you can very welcome after this to visit my channel, Breathe and Thrive. So we are familiar with the gut brain axis, gut and heart axis, and there is also a gut immune lung axis, which I would like to bring it on here. There is actually a communication network, a bidirectional communication between our gut microbiota and the lungs. And this is actually mediated by the immune and metabolites and the systemic inflammation. So the gut microbiota impacts our immune responses and our lung health. And the imbalance in the microbiome, that is dysbiosis, is linked to our respiratory disease severity. And higher levels of specific anti-inflammatory gut bacteria can correlate with a better lung function and reduced COPD prevalence. COPD stands for chronic obstructive pulmonary disease. or of the chronic respiratory disease. And I've spoken a larger bit of it in my channel as well. So do visit after the session to learn more about it if you are very curious to know about it. And so I pointed out two researches which is related, and you're more welcome to read the research. So what's the takeaway I'm going to give you today is from this slide is understanding this gut immune lung axis opens more channels about the microbiota targeted therapies and dietary intervention. So this is actually now is a booming research area in the healthcare sector and the health and well-being sector. So which will actually impact the policy and changes for preventive care in our community. And I would like to now bring light to the metabolites and inflammation. The diet-derived short-chain fatty acids, that is butyrate, that produced by our gut microbes that modulate our immune responses in our system, and that actually can reduce the lung inflammation in experimental models. So this is some evidences in the paper, and you can very welcome to go back and read the paper. And the nutrition and the microbiome support strategy may have a role in managing this systemic inflammation. When I point out the systemic inflammation, for people who are not aware of what is systemic inflammation, it is the internal organs, the responses in our blood vessels, the white blood cells and the platelets, and that react to the foreign body. So our immune, we have soldiers inside our body which fights against the enemies, that is the viruses, the bacteria that attacks our body. And during this process, there is inflammatory response happening. That is that's the systemic inflammation. The nutrition and the microbiome supportive strategies can have a role in managing this systemic inflammation and also the respiratory health. I don't need to talk about the topic on stress. We all have stress, and with the pandemic and before the pandemic, and there is a higher projection of mental health issues. One in four people in UK data been confirming that. So we all have stress. So is stress good or bad? To some degree, certain level of stress is needed to activate or to trigger our responses, because all stresses are not bad. But if the stresses are very chronic, then that lands us into a disease problem, into a mental health problem for a long term. So the chronic stress activates the sympathetic nervous system, driving that inflammation, affecting all these three systems: the respiratory, the immune system, and our gut. And this then cascades the inflammatory responses. The systemic inflammation then crosses our tissue boundaries, creating the symptoms that in the lung, metabolic function, and the gut. And then disrupting the dysautonomia, that is, the autonomic nervous system is disrupted. So, disrupted nervous system then regulates our breathing, digestion, especially the gut motility and the permeability in our gut is disrupted, resulting in the microbiome immune interaction, and then also influences the glucose metabolism. And these all are interconnected. And I mentioned about the autonomic nervous system here. Those who are not familiar with that, please do visit my latest video on my YouTube channel on the conscious breathing. I've clearly explained on that. Now, all these things, when the nervous system is actually then disrupted, then our breathing patterns is also becoming dysfunctional. Our CO2, the carbon dioxide, is altered, and our vagal tone is altered, which is very much needed for a rest and restore or healing of our body. So that alters the blood chemistry, nervous system tone, and inflammatory markers like C-reactive protein or interleukin 6 throughout our body. And so that's how the cascade happens with our stress. So the stress actually affects our systemic nervous system function, and also inflammatory cascades, and affecting both of them, the changes in the immune and the nervous system, then activates a dysfunctional breathing, which then alters our whole system functioning. So this cascade then lands us in a symptom cluster together. So talking about the symptom cluster, this is very important for us to understand. So the most of the symptoms projected are out of this dysregulation, which I've spoken in my earlier slides. fatigue and brain fog. Most of us often experience this, and this results from the inflammation, poor oxygenation, and blood sugar instability and gut-derived neurotransmitter disruption. All these are working in that concept. Then this is producing the symptoms or projecting the symptom out as fatigue and brain fog. And the other symptom is the mood changes, and that is influenced by our gut brain axis and chronic inflammation and disrupted breathing patterns and metabolic dysfunction. And overall is due to the change in the neurochemistry. And that displays as a mood changes. Systemic inflammation, this creates a feedback loop where the respiratory symptoms worsens and the gut permeability drives metabolic dysfunction and increases inflammation. And finally, energy is dysregulated. Poor mitochondrial function, insulin resistance, and hypoxia, and digestive malabsorption, all these combine to deplete the cellular energy across the system. So, energy flow is disrupted as well. So this is very much important, understanding this pattern to recognize what's happening beneath the surface. Why am I feeling this way? Or why my patient is having these symptoms? And that's why I wanted to bring the slide to you today. Now, so what is then we can do to fix it or to reduce the symptoms? So, integrative strategies is very much important because collaborative care improves the multimorbidity outcomes because our organs are interconnected, our organ speaks to each other. So, we need to have an integrated approach. The very first one I would like to point out is the conscious breathing practices. It is one of the breathing or breath is one of the practical and free accessible first aid kit inside a body. And please do go back and watch my video on that. And that actually then sends a signal to your nervous system, and nervous system then activates your parasympathetic, your vagal tone is corrected, and that then also influences your inflammation levels, where the inflammation level is going to go down, start to heal, because your body tells that you're safe when your breathing is safe. So that's the one thing which we all forget to do, because breath is the only thing in our body that is more consciously we can do or unintentionally we can do. And most of us in this fast-paced world breathe unintentionally. And that to a greater degree influences our other lifestyle behaviors and habits, landing us into chronic disease and symptoms for lifelong. But I believe that, I strongly, strongly believe that we are here on this world for a purpose, and we have a greater responsibility to maintain our health. And the freedom comes with responsibility. So we need to actually think of how consciously, to some part of the day in our life, daily life, consciously breathe and supply that nourish our cells and tissues across our body. And secondly, as the gut issues and immune are also playing a role, fiber and anti-inflammatory diet support is very much important. And third one here I would like to place a greater emphasis on is the community education, awareness. Like this today, the webinar, we're all coming together to learn about what is happening, what is there, and also the professional training. And not all professions are aware of what's happening. Yeah, and we all professionals, healthcare professionals and practitioners are performing our roles in silos, but we all have best interest in our patients or clients. And so I think the best interest comes with collaboration to a greater purpose and also to greater health outcomes in a positive way. So I want you all to think about what is that I can learn every day, because every day we are learning something new. Every day our brain is thirsty and curious to know what is there out and how better I can be today, or how I can better offer my value to other people. So if you're one of those people, I think you'll understand what I'm trying to say here. So community education and professional training. And finally, it is very much important that we have a research on how what we do is working for people or not, so that we can audit ourselves to a better place and better care and intervention. So I would place an emphasis that if you're a community of practice, please focus on the prospective randomized control trials or the pilot clinical trials to publish your practice and to get the community know, and also to grow the community with best practices and innovations that can help people to control or to manage this multimorbidity symptoms. Now, in terms of the public health context, I would like to point out that stress physiology is a very much so a modifiable risk factor. But when I see out there, it looks like people are actually believing that it is a lifelong thing. They have to be happening with a chronic stress, and that leading to a chronic long-term conditions, which is not. So if you actually, the mindset also plays a major role here. So now I've explained the stress physiology very, very briefly, but in depth in my videos. You can go and watch later in my YouTube channel. So that is a modifiable risk, and then think of what's that you can actually do for your clients or your patients for your population well-being. And early recognition can support the secondary prevention and reduce progression to severe multimorbidity. So I would like to emphasize these 2 points as a takeaway, that stress is not permanent, it is a modifiable risk factor, which we all can collaboratively work on. Public health and integrated care is key here, and that both WHO and our national guidance, that is the Integrated People-Centered Health Services and Non-Communicable Disease Action Plan, both support the holistic care, and the NICE guidelines also emphasize integrated care for chronic condition and long-term condition management. So we all aware of it, and I think we are working on it, but we need to make it more innovative, more easily consumable by every part of the community, because there is a major health inequality and inequity persisting across the nation. So I would like to emphasize that we are becoming aware of this needs to be reaching, that the collaborative care for the three conditions, the respiratory, diabetes, and the gut issues, should be in an integrated care pathway. And coming to my slide of reflection, this session is all about a brief knowledge and wisdom sharing. So I want you to take a moment to reflect on what patterns do you see in your own health or patient population. Take a few seconds to reflect on this first question. You can quietly reflect, write on a piece of paper for yourself. It is all about personal growth today. If you would like to, what is your experience and you're happy to share, you're very welcome to share your reflection in the chat box. Now, I have second reflection question. How might a whole person framework change clinical or personal care planning? It's a very important question. And I believe and hope so that you have understood the essential or the importance of integrated care, collaborative, working with all the practices together. Now, I would welcome you to continue this reflection if you have not found any of the thoughts now at the moment, and let's move on. I would like to conclude with a key message. Today, my key message is very simple, and I believe so it should be a powerful one as well. Our body works as an integrated system. So, when we understand that, our interventions become more compassionate, effective, and sustainable. So, thank you for your presence, your curiosity, and your engagement today. And I hope this today's session has achieved its intent of reminding us all that health is relational and interconnected. So I want you to continue the reflection, as I mentioned earlier, and reflect on what is that you actually gained through the session, what resonated very well today. And perhaps it is a new way of understanding your symptoms, or a framework that reframed your clinical thinking, or it is a small practical strategy you can begin to apply in your clinical practice today. Very welcome, and I'll be happy if that has happened. And change does not require doing everything at once. I believe it's small changes make a huge difference. And it all comes or begins with awareness, regulation, and intentional one step. There is more videos, as I mentioned, through my presentation and my Breathe and Thrive channel, or with the handle of at Breathe Thrive with Devi. You can actually very welcome to go and have a check. And if you have any doubts or you want to have to discuss any particular thing, do drop me a message or a comment, or contact my email directly. So it's on my website. You can visit my website, www.tele-therapies.org, or we have WhatsApp services as well. So you have the number there, so you can WhatsApp me with any questions or reflections you would like to discuss. More welcome, and I'm happy to do that with you. And also, there is a next free health and air webinar coming up on the 19th of February 2026. So the topic is on the nervous system at the center of blood sugar and digestion. So sign up for the session if you would like to have a lifetime access. Otherwise, I'll be streaming it in my YouTube channel and also in my LinkedIn. I hope so you had a great journey in the session with me, and your curiosity is appreciated. And I would like you to continue that reflection throughout the day. Have a good day. See you in the next webinar.